Is microneedling safe in patients with keloids? Microneedling is considered safe, minimally invasive, and collagen-stimulating. But what if your patient has a history of keloids? Can controlled micro-injury trigger uncontrolled scarring? Today we're going to look at what the evidence actually says. Step 1. What is a keloid? A keloid is not just a thick scar. It's an abnormal wound healing response. In keloid-prone patients, fibroblasts are overactive. They produce excessive collagen, particularly type 3 collagen. There's increased TGF-beta signaling and prolonged inflammation. Most importantly, keloids grow beyond the original injury. That tells us something important: these patients don't regulate wound healing normally. Step 2. How microneedling works. Microneedling works by creating controlled micro-injuries in the dermis. That injury triggers inflammation, activates fibroblasts and stimulates collagen production. In normal skin, this leads to remodeling. In keloid-prone skin, that same cascade may become exaggerated. The mechanism that makes microneedling effective is the same mechanism that may trigger keloids. Step 3. What does the evidence say? There are no large randomized controlled trials specifically studying microneedling in patients with confirmed keloid disorder. However, wound healing literature consistently shows keloid-prone individuals can develop abnormal scars after surgery. Piercings, acne, laser resurfacing and even minor trauma. Dermatology guidelines generally list active keloid or strong keloid history as a relative or absolute contraindication to procedures that cause dermal injury. We also know the chest, shoulders, jawline and upper back are high-risk areas. Facial keloids are less common, but not impossible. Step 4. What are the actual risks? In a known keloid former, microneedling may cause new keloid formation. Hypertrophic scarring, persistent nodularity, post-inflammatory hyperpigmentation and prolonged erythema. The risk increases with deeper needle depth, greater than 1.5 mm. Aggressive passes, RF microneedling, higher thermal injury, and treatment over high-tension areas. Step 5. Clinical decision-making. Ask yourself, 1. Has the patient formed spontaneous keloids? 2. Or only after surgery? 3. Where were they located? 4. Are we treating a high-risk anatomical area? 5. What is the true indication? Important distinction: a patient with one small ear keloid after piercing is different from someone with multiple chest keloids. For facial rejuvenation in a true keloid former, I would be extremely cautious. In many cases, avoid deep microneedling altogether. Step 6. If you decide to proceed. If treatment is considered, use conservative depth. Avoid high-risk zones. Reduce number of passes. Consider patch test area. Document informed consent clearly. Consider prophylactic silicone gel post-procedure. And give patient information regarding treatment and risks. But remember, there is no evidence that microneedling is safe in confirmed keloid disorder. Absence of evidence is not evidence of safety. Most important, sign a consent. Closing summary. Microneedling stimulates collagen. Keloids are excessive collagen. That alone should make you pause. In known keloid patients, microneedling carries real risk of abnormal scarring. Patient selection is everything. When in doubt, don't create injury in a patient who heals abnormally. Thanks for watching. Like, comment, subscribe, and share to support the channel.